Thanks so much for joining me.
Thanks, Evan. I'm so excited to be here.
Yeah, so I found you, I believe it was on Instagram. You were doing some videos about vestibular migraines, and I hadn't actually heard the term vestibular migraines. I'm very familiar with the vestibular system, which I want you to help us understand what's happening. How does this thing dysfunction? And I thought, wow, that's interesting. I believe it was a video you did about the grocery store. And you were asking, did people have like chronic dizziness or are you having issues with a grocery store? And my own personal experience with grocery stores, even Whole Foods, it's moldy. You've got all this produce being sprayed and misted, so there's a lot of moisture. You have these refrigerators that are not being maintained properly. So I think some of it is mold issue for me, why I react to certain groceries. And then chemicals like laundry, toxic dryer sheets. I think the chemical sensitivity is probably playing into it in a conventional grocery store, maybe the lighting as well. But I guess before we go into that, could you just give us like the vestibular system 101? How does this thing work? How does this system help us navigate through life with proprioception and where to put our feet in space and all of that?
Absolutely. So the vestibular system is something that most people never think about until something goes wrong. And when something goes wrong, it has a very profound impact on your functioning. But essentially, kind of the bare bones of it, there's three main systems within the vestibular system. So your brain is detecting input from your eyes, from your inner ear, and from proprioception or touch sensation. And when I say touch sensation, it means how your feet feel on the ground, how your back feels against the chair, how these muscle fibers are in your neck and in your head to kind of know if am I standing up straight? Am I leaning over? And something can go wrong in any of those systems. And so we have peripheral vestibular disorders. That means there's something wrong with the inner ear itself. So that would be something like BPPV, benign paroxysmal positional vertigo. That's where like the crystals get loose in your ear. That's the most common cause of vertigo. Or you can have a central vestibular disorder, which is where that's more of a connective issue with your brain and spinal cord. And when you were talking about the grocery stores, that's a very common complaint I see with people. So I would say the most common diagnoses I see would be vestibular migraine and something called triple PD, persistent postural perceptual dizziness. And you can get triple PD as a secondary diagnosis or secondary dysfunction from any sort of initial vestibular insult or from anxiety. So any initial experience of dizziness is almost like your brain goes into PTSD mode and it doesn't really recalibrate normally. And so it becomes like a sensory processing disorder due to negative plasticity. And I would say an inflammatory component just based on my personal experience and what I've seen professionally. So again, going back to the grocery store example, a lot of people who develop vestibular disorders, whether they're central or peripheral, can go into this mode called visual dependence, where you want your brain to be sort of taking input in a balanced way from those three systems. So vision, inner ear, proprioception. But when things go awry, your brain starts to preference vision. And so when you preference vision and you end up in very visually stimulating environments, the grocery store, computer screen, scrolling on your phone, it's too much. And that makes people feel terrible. They experience visual vertigo. They might feel like they're walking on clouds. They just feel really out of sorts. And so, yes, I think all the things you listed, multiple chemical sensitivity, maybe there's mold in the grocery store, light sensitivity is a huge issue. And we know a lot of this stuff also relates to central sensitization. So as our brain and spinal cord become more and more sensitized to different things, we start to become sensitive to everything in the environment. So grocery stores can be kind of like the worst nightmare for someone with chronic dizziness.
In the shelves too, you got these like long hallway looking shelves, and think it's kind of overwhelming. You mentioned something interesting, which was you threw anxiety into the mix here. So you're mentioning all these things that happen with nervous system and all that, but then you mentioned anxiety, which to the ignorant will say they're like, anxiety, interesting. I thought it was an ear issue. I thought it's a brain issue. Now you're saying anxiety. That sounds totally unrelated. How does anxiety play into this?
Yeah. So I almost even hesitate to use the word anxiety because it's so stigmatized. And for people with chronic dizziness who have gone to their primary care doctor, who have gone to an ENT or a neurologist who don't specialize in vestibular issues, they're told it's just anxiety. Like, move along and it will get better on its own, or you need to see a psychiatrist or you need to see a therapist. But the bottom line is, anxiety is nervous system dysfunction, essentially. And so when you get dizzy, we have this normal sympathetic response to it. So you end up in this fight, flight, freeze. The problem is when the dizziness persists and you end up with chronic dizziness, you end up in this state of sympathetic nervous system hyperactivation, essentially. And so, of course, you're going to be hyper vigilant. You're going to be scanning your body for symptoms. You're going to start being sensitive to everything because your nervous system is like, this is too much. I don't want too much visual stimulation. I don't want anything new. People end up becoming sensitive to supplements and foods and medications and everything. So I think the stats are that people with vestibular disorders, meaning chronic dizziness, are 3 times more likely than the general population, meaning people without vestibular issues, to experience anxiety, depression, and panic disorders because it is so unsettling to contend with these symptoms on an ongoing basis.
Yeah, it's hard. I mean, I've been through hell with it. I know you have too. You mentioned in your bio in 2017, you had several different diagnoses and you've experienced a lot of it. And before we hit record, we were talking about mold briefly. So I want to get into that with you. So, what do you think? What was your deck of cards? What were you dealt? What do you think added up? Because when I look at this, just me going through it personally and seeing hundreds of cases of different manifestations of it, no 2 cases are the same. And that sounds cheesy to say, but there could be mold is 60% for this woman, and for this guy over here, it's massive mercury, right? He's got tons of heavy metals in his mouth. And then for this girl over here, she lived next to agriculture. She's got a lot of pesticide spray exposure. When the pesticides are being sprayed, she's more symptomatic. And then you've got this chemical sensitivity girl over here, and then you've got this guy with Lyme over there. So what was your sum of parts that added up to your issue?
Mm-hmm. It's really interesting. And I find that people, there's sort of like the conventional way to approach this, and then there's the functional way to approach it. And I feel like you really have to marry the two. And I actually just got a question on Instagram today. It's like, how do I know that I have mold toxicity versus just having vestibular migraine issues? And I'm like, they're the same thing. It's like you don't just get vestibular migraine issues by chance. It's some sort of genetic, epigenetic predisposition potentially, and then the way the environment interacts with that and creates this inflammatory problem. So I don't think it's just by chance that you have vestibular migraine. But so going back to the mold story, so I was initially diagnosed with a very rare vestibular disorder called superior canal dehiscence syndrome, which is actually a physical defect in a bone kind of like right above your inner ear. And I had multiple surgeries for that. It was after that, though, postpartum, where kind of vestibular migraine and triple PD reared its ugly head. And at that point, I didn't even know what functional medicine was. I didn't know it was an option. I didn't know that looking at symptoms from more of a root cause approach would end up speaking to me in the long term. So I kind of went the conventional medicine route first, was diagnosed with vestibular migraine and triple PD, started on medications, and I wasn't getting that much better. Like it would make maybe a 10% improvement. And then that's when I learned about functional medicine and looking at environmental toxins and that type of thing. And we ended up, and I see this all the time in my practice, bringing in mold inspectors. They say everything's fine. They do an air sample in the middle of the room. They say everything's fine. Or like, oh, the mold in the grout in your bathroom is normal. Everything's fine. And I was like, there's something missing here. So I ended up just ordering actually mold lab test to look at IgG and IgE reactions, and my IgEs were off the charts. And I ended up having a consultation with someone at this lab, and he was like, you have mast cell activation syndrome based on these IgE results. And so that just sent me into this, like that just completely opened my world and my vision into a different way of looking at all of this and looking at histamine and how mast cell activation works. And it opened up really a whole new world of treatment options beyond just the standard like migraine prophylactic medications or abortive meds or rescue meds. I hope that answers your question.
Yeah, it does. It does. And let's go deeper into mast cell in a minute. But first, I want to ask, what is a vestibular migraine? When I hear vestibular migraine, I just think your head hurts, but it's probably not that.
That's a great question. So there are a bunch of different migraine let's call them variants. And vestibular migraine is one of those. So it depends on it's still a migraine process, but it depends on what parts of your brain are impacted. And actually 50% of people with vestibular migraine do not have head pain. And so it's really confusing for people who are seeking answers to their symptoms to go to a neurologist or a neurotologist and they say you have vestibular migraine. And then like, that was never on my radar, because when I hear migraine, I think head pain. So it comes in attacks. It's usually dizziness, vertigo, light sensitivity, sound sensitivity. You might have a history of migraine. You might have a history of motion sickness. So I think it's becoming becoming better understood. I think people are becoming aware that it's not that rare. And it's, I would say, the most common diagnosis that I see in my private practice.
Yeah, I believe it. So the hard part is, how do you tease it apart? Like when I've been exposed to mold, or based on me having tick bites and having Lyme and Bartonella, Babesia, all the stuff I've been through, some days are amazing and then other days not so good. And then I had a period for a while, I've talked about it many times, where I was so dizzy I literally couldn't drive a car. I was just out, like it's almost not even dizziness. Like dizziness it's so hard to describe. It's almost this disequilibrium. It's this kind of weird floaty thing, like going from, you get to a stoplight and you feel weird. Then you get on the gas pedal, you feel weird. Or being on a train, you get off the train, you feel weird. Like, would you still describe that as dizziness, or is that almost like, is that still in the vestibular migraine category? All that?
Yes. So a lot of times with vestibular migraine, it's provoked by movement, it's provoked by exercise, it's provoked by changes in routine, changes in diet. There's certain dietary triggers. Some people will try like low histamine diet. Some people will do well with keto. So there's a huge dietary component. But yes, it kind of throws your whole vestibular system off. A lot of people will do really well with like vestibular rehab physical therapy to help recalibrate things. But it really has to be treated from a multidisciplinary perspective. So yes, there's the mold and there's the Lyme. But again, diet, nervous system is hugely important. Physical therapy can be really important. Body work, like osteopathic manual manipulation, can be important, or cranial sacral therapy, acupuncture. Some people do well with chiropractic. Some people like neuromodulation devices for like the vagus nerve or the trigeminal nerve. So when people come to me, I really am looking at the big picture. Another really important one to mention is a history of trauma makes people experience their dizziness as more severe, because people tend to be hypervigilant to bodily sensations, constantly scanning to see, is anything wrong? If you find something wrong, you put your attention on it. Your attention kind of creates new neural networks around it. So it's a lot to take in. It's confusing for people when they're first diagnosed with a vestibular disorder or seeking diagnosis, because it's so much to try to digest yourself and to try to figure out yourself. And I've been on this journey now, like you said, since 2017, and I'm still learning new things. And so it's a big challenge for people for sure.
Yeah. And the tricky part is, this is probably a clinical diagnosis, right? There's not a specific lab test that's going to go, hey, that's this, tested positive for vestibular migraines, right? Like maybe you'll see elevated HSCRP or some kind of inflammatory markers in blood, or maybe if you do a stool test, you'll see inflamed gut related to this, but it's pretty much clinical. Is that right?
Correct. So usually if you go to a vestibular neurologist or a ear specialist, a neurotologist or an otologist, they'll do a battery of tests. So they'll want to rule out other things. They'll do an MRI, a CT, which come back normal in most cases for vestibular migraine, and then they'll do balance testing. So they'll look at your hearing to rule out like Meniere's disease, for example, and then they'll look at how the vestibular system itself is working. I would say it's not, that doesn't always come back clean in everyone, because some people will develop vestibular migraine after having an infection like vestibular neuritis or as some other insult to the balance system. This has happened a lot post-COVID. I've seen it a lot in my private practice. But in general, yes, all this testing is to rule out other things, and vestibular migraine tends to be a diagnosis of exclusion.
Yeah, this has got to be huge after the virus. I just typed in real quick, just like PubMed, vertigo, the virus, and it shows up. I mean, it's a big percentage depending on what paper. There's some papers saying 8% long-term dizziness. I saw some African study the other day that was saying like long haul syndrome is like 50%. Like people who had the virus, 50% of those people have long haul syndrome, and dizziness could be part of that. So yeah, it's kind of a mess, and that's not even throwing the injection into the
I was
mix.
going to say, I saw a paper that said for the vaccine, I think the paper was out of Korea. I think dizziness was either the second or third most common side effect. It was like 16% of people. That's not chronic dizziness, but again, we can't really delineate like how many of those went on to develop chronic dizziness issues post-vaccine.
Yeah, I mean, we're still kind of early on, so I mean, 5, 10 years, who knows? I don't
Mm-hmm.
like what I'm seeing already, though. Okay, so you said postpartum earlier. Okay, so you do have kids.
I have one. I have a 4-year-old son.
Okay, cool, cool. I've got a 4, almost 5 also, and then 2 more. And kids will put you through it. So like what's your day-to-day now? What's helping you? What's not helping you now? Like if you are stressed out because you have a little one running around the house driving you crazy, begging you for snacks, does that flare up your symptoms? Like talk us through, where do you personally find your roadblocks, or where do you find like I got to be careful around XYZ, like hypoglycemia or this or that? Walk me through some of that.
Yeah, I would say that my symptoms were much more flared when I was living in a moldy environment. So I moved from California to New Jersey about 2 years ago and so I guess he was 2 at the time. And so, like, for example, grocery shopping felt impossible. Like you said, the driving, the busy environment, and then a toddler, like grabbing things off of shelves felt totally undoable to me. So I would make accommodations for myself, like get grocery delivery, or if I knew I was not having the best day, I might take him to like an open field and let him run around where I don't have to do that much visual scanning. I don't have to watch him climb up playground equipment and like chase after him in that way. I think now my symptoms are at a really good place where I don't have to make those types of calculations that much anymore. But I would say that I have to be very regimented in terms of what you said, blood sugar regulation. I have to be on top of sleep. I try to be on top of stress management as much as I can, but as a military spouse with a son and businesses to run, like that's very challenging. So I would say trying to find reinforcements where I can, like having a babysitter on hand if I need to, giving myself grace with like I need to lie down. I'm going to let him watch TV for a few hours and not feeling guilty about that. And then kind of congratulating or celebrating when I do have a win, when I now I would say like I can go to Home Depot or Target like very comfortably and just recognizing how far I've come because it's a big vestibular challenge to have young children because it's so physically demanding on top of managing chronic dizziness. But I want to provide hope for people too that it really, really can improve.
Yeah, well said. That's interesting. I never thought about that until you kind of called it out like that. But yeah, like if you're at a playground, I mean, I've got a little one, almost 2, the almost 5, and then the almost 8. And that definitely, I will notice it'll kind of ramp things up. So you're saying the
Mm-hmm.
scanning can actually increase your symptoms because
Mm-hmm.
you're looking over here at the small one because she fell
Yes.
over I don't know, a parking thing. And then this one's at the top about to fly off the swing. And then this one's over here got her head stuck in the playground equipment over here. So you're saying that level of, I guess you would call it almost like an adrenaline fueled scanning. You're saying maybe there's an adrenaline or cortisol component as well that's making the brain more reactive with the dizziness. Is that what you're saying?
I think for sure there is a just like that nervous system component of trying to keep everyone safe and that kind of threat that essentially you're in a threat because your kids sound like they're all trying to kill themselves, which is like what happens on a daily basis, at the park. But beyond that, just the demand of physically visually scanning is very challenging for the vestibular system. And when you do that infrequently, your vestibular system is not very well conditioned to do that. So like in, for example, vestibular physical therapy, I like when they function or that when they focus on functional things of like, I'm having trouble with these things in my daily life and you practice them over and over to kind of help recalibrate your system. But yes, I think it's the cortisol. I think it's the nervous system kind of perception of danger, but then also the physical visual scanning.
Okay, yeah, I mean that makes sense. Something that men might relate to if they're hunters or fishermen. I know for me, if I'm hunting, if I'm out in the woods, you may hear a squirrel come in and you're thinking it's a deer. And so all
Mm-hmm.
of a sudden you start getting this rush. And when you start getting ready to either pull the bow back or you get ready to pull the trigger on an animal, you're potentially taking an animal's life to feed yourself, feed your family, your vision changes completely. And right after pulling that trigger, I've had massive rushes of dizziness just come, just boom, like,
Mm-hmm.
whoa. and then you settle down from it, but it's definitely a rush. So I think there's got to be some hormonal piece. And I think you keep mentioning the nervous system too. I think it's got to be just that sympathetic overdrive. And these issues seem like modern problems. I always go back to our ancestors and I'm like, okay, did we have this issue 200 years ago? Did we have this issue 20,000 years ago? I mean, it just seems like now there's so many more assaults, whether it's the EMF, you mentioned the screen, like scrolling on your phone. You mentioned scanning the environment. I feel like if you and I were together, we had a bunch of kids in the woods with us, maybe if that's all we knew, we would probably have less of this issue.
It's a good question of like, why now? Like, why is there so much mold illness now? Because mold is not a new problem. And I think it's a complicated question and a complicated answer, but I think it's a combination of how toxic our environments are. When I was doing a review for this, I think it's like there's something like 84,000 chemicals in US commerce, and only a few hundred of them are regulated, which is pretty scary. So there's that combined with nutrient deficiencies and how our soil is depleted. And so that messes with methylation and our detox capacities, combined with the stress and isolation of not living in like multi-generational households, not being set up for success with parenting. And so this chronic stress I think all of those factors sort of lead to the perfect storm.
Yeah, well said. I was thinking about that yesterday, just loneliness, like you look around and you could have everything in the material world that you could ever dream of, and you could be totally miserable. I've seen videos of successful entrepreneurs on YouTube, guys that are driving Ferraris and live in massive mansions, and they'll tell you they're lonelier than ever, even if you have all that. So yeah, you make a good point that a lot of us, because of jobs, or like you mentioned, you traveled cross country, now you're across country. So people that are uprooted, I think at some point when you don't have, or at some level, if you don't have that friend or family root, now you're automatically almost more survival mode, because now it's you, your husband, the kid, and you don't have that phone to pick up and say, hey, come over and help. So I think that's got to be part of it too. It sounds like a lot of it's just going back to us just being stuck in fight or flight survival mode. Do you play with herbs at all? Like, have you tried passion flower? Have you tried any kind of calming herbs? Do you notice if that helps you at all?
I passion flower is a new one. I'd love to hear more about that. So I would say I haven't.
How about magnesium, CBD? What about cannabis? I mean, New Jersey's a fully legal state, isn't it?
I think it is. I have not dabbled with it. Magnesium, yes, that's kind of like the number one thing you'll see people prescribe to help with migraine. So the ones that I have found most beneficial for me, magnesium, Chinese skullcap, I love. I feel like it works like better than an antihistamine. Ginger, I'm a huge fan of that. There's research actually that shows that ginger performed as well as Claritin for seasonal allergies, and ginger performed as well as a migraine abortive medication to help abort a migraine attack. What else?
Oh, let me say something on that too.
Yeah.
That's really interesting, because with the vestibular stuff can come nausea, and there was a paper on ginger versus Zofran. And ginger actually outperforms Zofran as well.
That's interesting. I haven't seen that paper, but that's really good to know. And Zofran is very widely prescribed within the vestibular community, and it personally gives me a headache, so I avoid taking it. And so I think ginger is a great I don't get side effects from it. I know some people say it gives them kind of like a burning sensation in there.
I do chewable. There's a couple chewable brands that have like a little bit of xylitol or stevia in them. They hit pretty quick versus a capsule. So I've noticed it's been great. I mean, obviously we use it a ton for gut issues as well, but there's so another thing I'll throw into the mix is like the whole gut dysbiosis problem. Like I'm seeing a lot of people with bacterial issues. Those bacteria are producing massive histamine, and then those histamines combine with a high histamine food. Boom, now they're dizzy from that. So you mentioned histamine earlier. So you're seeing that antihistamines, even like natural ones, quercetin, some of the other things, those are to help calm this down. Those are working.
I'm a big fan of using any and all things available to us, whether that means things like herbs or vitamins, minerals, and prescriptions too. But yes, I have seen antihistamines, mast cell stabilizers, again, prescriptions and kind of nutraceuticals be very helpful for people with this. And I think that the thing with histamine, and I'm sure you've noticed this in your practice too, is you have to be so diligent about like every little thing that you take in terms of histamine levels. Like, for example, with probiotics, there's certain probiotic strains that promote histamine. And so I've had some people say, why can't, probiotics are supposed to be so great for you. Why can't I tolerate them? And it's like, okay, we have to figure out, let's find strains that are less histamine producing, like spore-based probiotics, for example.
Yeah, well said. So, have you seen any other therapies that calm down the nervous system to help pull it out? Like you mentioned on your website, you have up in the menu bar, you have a link that says meditate.
Mm-hmm.
So,
So that,
what's your idea
yeah.
there?
So for nervous system calming, that is probably the number one most important thing that I talk to people about. And again, I like to use all the tools available. So things like meditation, progressive muscle relaxation. I'm a big fan of biofeedback, which is pretty accessible to people since they now have like kind of like the handheld, like HeartMath is the one that I use in my practice. Recently have gotten more into somatic based approaches like emotional freedom technique, EFT tapping.
Let's talk about that because
Yeah.
I love tapping. So, are you just tapping even though I'm dizzy? I love and accept myself. Like, are we just doing affirmations about the dizziness itself, or how would it go?
I've done different trainings on it and they have kind of different approaches. So one of the ones that I really like is actually focusing on negative emotions associated with some type of event or situation. So one that I did the other day with a patient was overwhelmed about work. And so we would tap specifically on that and that person would think about that. And we start with like 0 to 10, how overwhelmed do you feel about this work project? And she would say, I don't know, an 8. And then we would do kind of run through this tapping routine, focusing specifically on that. So I guess we're actually focusing on the problem rather than affirmations. And it's really cool to see how much that number comes down very quickly. And then another protocol that I was taught that I have found works pretty well is with bodily sensations. So whether that's pain, I've done that for a lot of people with vestibular disorders report like an internal buzzing sensation. So I've done that for internal buzzing, and you use kind of ways to describe it. So like you'd say, what does it look like? Is it dark or is it light? Does it feel heavy? Does it feel light? If it could talk to you, what would it say? So kind of these, I guess, more abstract ways of discussing pain or a bodily sensation, and you're tapped specifically on that. And I've seen the numbers come down quite nicely with that too.
Cool. One thing that really helped me, but it also one of the major side effects is crazy amounts of dizziness and definitely nausea is ketamine. So have you looked at ketamine, used it, talked about it, thought about it?
I haven't used it myself. I have looked at some of the research on it, and I've been very curious about how that might impact chronic dizziness. I'd love to hear more about your experience with it.
Yeah, I mean, it's amazing for the trauma piece, anxiety, depression, treatment-resistant depression, like any like mental issue that could be contributing. If you're just stuck in fight or flight, you're a mom, you've got kids, and life, the dial of chaos is turned to a max.
Mm-hmm.
The ketamine will really, really turn that dial of chaos in your life down.
Mm.
But one of the major side effects I've experienced with it, definitely you get dizzy, definitely you get nauseous, you get woozy. It's probably a toxin. I mean, long-term studies on like repeated ketamine, we're talking tons of ketamine, doesn't look good for the brain long-term. So I think this is a tool that you want to come in, try to help support your trauma, help support anxiety, depression, whatever mood issue you have, and then get out of it, get it out of your system. Maybe there's a place for doing like boosters where people every 6 months or so are throwing some ketamine back into the system, either intramuscular or IV. There's nasal sprays. There's like in the mouth, like troches, these little dissolvable lozenges I've heard about. I think the IV is probably best, or maybe the intramuscular. But if the trauma of your life is contributing to that sympathetic overdrive, which then drives the vestibular problems, I think it could be a good tool. I certainly felt like when life was too noisy, too loud, it definitely was like a good reset button.
Great. Well, that's really good feedback. I've wondered about that. I've wondered about, I think we mentioned before you started filming psilocybin, and how, because all of these things are so, like, the psychological aspect is so intimately connected with everything. I hate to even call it psychological because I feel like people think psychology and biology are different and they're really one and the same. But I have wondered how ketamine, psilocybin, things like that, these other kind of newer treatments, I guess if you want to call it that, would impact dizziness.
Yeah, I mean, there's cool papers showing the functional MRI studies where people have psilocybin. It shows just completely connecting all the regions of the brain that were previously not connected. There's some discussion of psilocybin helping with the amygdala to make the amygdala sort of calm down, or even actually reduce the blood flow to the amygdala, which for folks listening, that's like your fight or flight part of the brain. It's kind of deciding whether I need to freak out or not. Your amygdala appears to grow in size and sensitivity after you've had trauma. It seems that these people have I mean, you probably know this more than me, but it appears that like increased trauma, increased chronic stress affects the amygdala to now, if you had, we'll use a gun analogy, if you had a trigger that was a hard pull, meaning it took a lot to really break you, chronic stress, trauma, nutrient deficiencies, all that adds up to where now you have a very light trigger. Boom, the gun goes off. If you hear one little sound, you're freaking out.
Yes, that is exactly how neuroplasticity works, of like our brain, based on our experiences and our behaviors and beliefs, rewires itself based on what it thinks is most important. It's kind of like a survival mechanism. And so if we're constantly in perceiving danger and in these sort of traumatic situations, which having chronic dizziness and navigating the medical system in itself is a trauma, for sure your amygdala grows and the blood flow increases, and it creates that the structure itself gets bigger.
It's crazy. So that you're literally wiring more hypervigilance.
Exactly.
Okay, so at first it's like, okay, good, we're trying to protect you. Let's be a little more vigilant, but then that message never turns off.
Exactly. And that's essentially what triple PD is.
I see. Yeah, I've interviewed the heart math guy, I forget his name, this probably 7, 8, maybe 10 years ago. I interviewed the heart math people. And then also we had on Mr. Gupta.
Ashok.
Ashok, yep. So, and we talked about how he's seen in these chemical sensitivity cases where just doing certain meditations that he's taught calms down the sensitivities. And it's like, okay, interesting. It's something where I think you have to be, and as you mentioned in the beginning, you have to kind of be suffering enough and miserable enough to listen. So when your average person hears meditate to help your problems, they're just like, whatever, I'm too busy.
Yeah.
But there's a famous saying that says if you don't have an hour to meditate, you need two. And so I hope people will listen to this message, and maybe this is interesting to them, but maybe they haven't suffered like you and I, or some of our clients listening, maybe they've suffered a little bit, but they don't fully relate to all this. I would encourage you now, if you feel like every other human, where you feel overwhelmed, you feel some anxiety, maybe you feel some insomnia or chronic stress in your life, but you're not to the point where you have this dizziness problem, or where stores are difficult or challenging for you, or loud environments are challenging, I'd start working on your brain, your nervous system now.
Definitely. I'm sure you can relate to this, but I look back over my life and I feel like there were so many instances of my body whispering to me that like something is not right. Symptoms here, symptoms there. And I just thought, oh, whatever, no one feels great every day, until my body started screaming and I had to listen because I couldn't function at all.
I think some of it is just being young, right? Like if you're in your 20s, it's like
Yeah.
your growth hormones peaking still, your hormones are peaking still, then you go 30s and beyond, and it's like I can't necessarily get away with all that. Like that grind hustle is a little harder now than it was.
For sure.
Okay, cool. Well, any other recommendations? I also want to send people back to your website. It's thevestibularpsychologist.com. People can check you out there. Also, your Instagram page is, so it's actually under your name. So we'll have that linked. We'll have that
perfect
in the show notes. And anything else you want to leave people with?
I think one of the things I always like to leave people with is just the hope that you have never tried every treatment to try. I get DMs every single day saying, I feel so hopeless. I've tried all these meds. I can't tolerate any of them, et cetera, et cetera. And there's always new things coming out. There's new combinations of things. And I kind of like to, I guess, leave people with that message of hope, and also please go slowly with treatment, because people get so excited and like they're like, I want to heal today, and it's a process and your body has to kind of move through that potentially at a slow pace, especially if we're talking about histamine muscle activation. So I think those two things.
Love it. That's always my final message too. I tell people just to have hope, because there's so much room to grow, and there's literally probably 100+ variables to this thing. So you got to tease it apart. And I find that when people do start to make progress, they want to run, and you got to walk before you sprint.
Mm-hmm.
And so people feel a little bit of relief. Maybe they get on a new supplement, a new med, whatever, and they get some relief. And then like, I'm going to go run a 5K now.
Mm-hmm.
And then I'm going to like do all these birthday parties, and I'm going to travel cross country and go out drinking with my girls. We're going to go like do a wine tour, and then we're going to go to this wedding and then this bachelorette party, and we're up till 2 a.m. And then they go backwards. It's like, yeah, you know, you got to kind of tiptoe here sometimes.
Right. I think that's true. And also people will start to do the nervous system supports and then they start to feel better and they stop doing them. And I see that merry-go-round all the time of like people who have graduated from therapy with me come back 6 months later, like I'm in a flare, and I'm like, okay, what things are you doing on a daily basis to maintain your health? Well, nothing. And so it's really about creating a life, like a sustainable lifestyle change for yourself.
Agreed. So I'll leave it with this, which is like, if you work hard, you got to rest hard.
Mm-hmm.
If you play hard, you got to rest. So I mean, if there's too much work, not enough play, not enough rest, it's imbalanced. No surprise you're going to have these issues.
Yep.
Well, thank you so much. This has been great.
Thank you. Thanks for having me.
Take good care.